In the world of medicine, some of the most powerful tools are the ones you can't even see. Today, we're pulling back the curtain on one of the most fundamental concepts in all of clinical practice, aseptic technique. Think of it as the invisible shield that protects patients every single day.
So let's just jump right in with a really critical question. Think about any medical procedure, from a simple shot to a massive surgery. How do we make absolutely sure that a moment of healing doesn't accidentally become a moment of infection? The stakes, well, they couldn't be higher.
And the answer lies in this constant, really disciplined battle against an enemy we can't even see: microbes. Healthcare-associated infections, you'll hear them called HIIs, are a massive risk anytime the body's natural armor, the skin, is breached. An aseptic technique, well, that's our #1 strategy in this fight, designed from the ground up to stop these infections before they even get a chance to start.
So, how has this battle evolved? Well, for years, the whole approach was kind of based on this simple but honestly often confusing idea of clean versus sterile. It just left way too much room for interpretation. So now we have the modern gold standard, designed for total clarity and consistency, the aseptic non-touch technique, or as everyone calls it, ANT.
ANTAD is a real game changer because it shifts away from those vague principles to a concrete, solid system. It's a standardized, evidence-based framework that gives healthcare professionals a clear, consistent set of rules to follow. What that does is reduce the guesswork, it reduces human error, and it protects the patient by focusing on what truly matters during any procedure.
And to get ANT, you really only need to understand two simple concepts: key parts and key sites. The easiest way to think about it is like a sterile key for a sterile lock. Key parts are the critical bits of your equipment, say the tip of a needle or the surface of a sterile dressing. Key sites are the patient's vulnerable spots, like an open wound or where an IV goes in.
In this diagram, this just lays it all out perfectly. Let's walk through it. You've got the practitioner, the sterile field, and the patient. The core idea here is that the sterile equipment, our key part, can only touch the patient's vulnerable key site. Any other contact risks breaking what we call the sterile chain. So by making sure the key part never ever touches a non-sterile surface, you prevent contamination. It's a really elegant and simple system, but it's incredibly effective when you follow it to the letter.
So, it all boils down to this one simple rule. This single sentence is the absolute heart of the ANT philosophy. By zeroing in on protecting these specific parts and sites, we maintain sterility right where it counts, no matter what's going on in the room around us.
Okay, so we've got the theory down. Now let's see how this all comes together in the real world. How do clinicians actually put this into practice? Well, it's all about something called the chain of asepsis.
First thing to know, not all asepsis is created equal. As you can see in this table, on one hand, you've got medical asepsis. The goal there is to reduce the number of pathogens. You'll often see clean, non-sterile gloves used for things like chronic wound care. But then you have surgical asepsis. That's the highest level. The goal is 0 microorganisms. It requires sterile gloves and a totally sterile field, used for things like surgery or acute wounds.
And applying this involves a strict 4-step sequence. Step 1, environmental preparation. Simple things like closing doors to minimize air currents. Step 2, hand hygiene. And this is non-negotiable. It means following the World Health Organization's 5 moments for hand hygiene. Critical points like before you touch a patient, before any aseptic procedure, and after you're exposed to body fluids. It's a critical safety net. Step 3 is wound cleansing, usually cleaning from the center and working your way out. And finally, step 4 is field integrity. This includes the famous 1-inch border rule, which means you treat the outer edge of a sterile drape as contaminated, just to be safe.
But look, aseptic technique isn't some static, old idea. It's the foundation that all this new technology is being built on. So where is this all headed? Let's take a look at the future of aseptic care.
This is where things get really interesting. We're seeing innovations like negative pressure wound therapy, which actually uses a vacuum to help wounds heal faster. The catch? It requires absolutely perfect surgical asepsis. Any tiny breach and the whole system could turn into a breeding ground for bacteria. Then you have things like smart dressings with biosensors that can monitor a wound's pH or temperature, letting you know if an infection is starting without ever having to remove the dressing.
And this isn't just science fiction. This stuff is being used right now. This chart gives you a sense of how it's being adopted. Negative pressure systems make up a big chunk, about 45%, with smart dressings and biosensors right behind. It shows a really clear trend toward merging these high-tech tools with our foundational aseptic practices.
So, this is about more than just a clinical procedure. The implications of getting this right, or getting it wrong, go way, way beyond the patient's bedside. This aseptic practice impact matrix is a fantastic tool for understanding risk. Let's break it down. On the bottom, you have how complex the procedure is, from simple to complex. And on the side, you have the risk of infection. So for example, chronic wound care might be pretty complex, but it has a lower infection risk. On the other hand, a routine IV insertion is simple, but it carries a high risk if your asepsis fails. And way up in that top right corner, you have things like that negative pressure wound therapy we talked about, both complex and high risk. This is exactly why a standardized approach like ANTT is so crucial. It gives you one reliable framework to manage risk across this entire board.
And of course, there are serious medical legal implications. Following aseptic technique is what's known as the standard of care, and meticulous documentation, making a note that standard ANTT was applied and that you check the supplies. That's not just good practice, it becomes a critical legal defense for doctors, nurses, and their hospitals if anything ever goes wrong.
So how does a hospital actually make all this happen? This timeline gives us a great roadmap. You kick things off in the first quarter with staff training and getting everyone certified. In Q2, you roll out prepackaged sterile kits to make things easier and reduce errors. And then for the rest of the year, you're focused on assessments and constant improvement. It's a smart, strategic way to do it.
So to kind of wrap up the big takeaways for any healthcare institution, the recommendations are really clear. First, you have to implement standardized audit tools to make sure everyone is competent. Second, use those prepackaged sterile kits to cut down on the chance of accidental contamination. And third, and this is probably the most important one, you have to foster a true safety culture, one that closes the gap between knowing the rules and actually doing it perfectly every single time.
And that really brings us to our final thought. We've got the rules, we've got the framework, we've got the technology. But the ultimate challenge, it's still a human one. Beyond all the rules and tech, how do we build a true culture of safety where every single person in every single moment is committed to upholding this invisible shield? That's the question that's going to define the future of patient safety.